But
Okay.
welcome, everybody.
Yeah, welcome everyone. Really thrilled to have you. I think we are right on time to get started here. My name's Joe Gogler. I'm the director of the Bold Public Health Center of Excellence on Dementia Caregiving, and we are so thrilled you are joining us today in honor of Alzheimer's Awareness Month, as well as in honor of National Family Caregivers Month. This topic on elevating dementia caregiving as a public health priority, and we've put together a fabulous panel that's really going to dig deep into emphasizing why dementia caregiving in and of itself is a public health concern and what we can do about it. So wanted to thank the John A. Hartford Foundation, as well as the National Alliance for Caregiving, for co-sponsoring this very exciting webinar with us here today. And I'd like to turn it over briefly to Ronnie Snyder, Vice President of Programs from John A. Hartford, for some of her preliminary comments.
Thank you so much, Joe. It's great to be here. As Joe mentioned, I am the Vice President of Program at the John A. Hartford Foundation, which is a proud member organization of the Bold Public Health Center of Excellence on Dementia Caregiving, and also a partner with the National Alliance for Caregiving in supporting today's webinar, as Joe mentioned. And I am personally honored to serve on the executive committee of the center as well. So on behalf of the John A. Hartford Foundation, I really want to welcome the audience today and offer our thanks to the center for its really critical efforts to build public health agencies across the country in their support for dementia caregivers in their communities. We're grateful to the CDC for the collaboration that they have with the University of Minnesota and the other partners on those centers of excellence. So for those of you who don't know as well, the John A. Hartford Foundation is a national philanthropy based in New York City, and our mission is to improve the care of older adults. So we do that through three main areas: building age-friendly health systems, supporting family caregivers, and improving serious illness and end-of-life care. And those three areas intersect in powerful ways. And all of them touch what we're talking about today. So delivering evidence-based age-friendly care to people who are living with dementia, a serious illness, and supporting their family caregivers are all the interlocking priorities for us and for the millions of families who are living with dementia and who ultimately need our support. So today's webinar on elevating dementia caregiving as a public health priority is especially relevant for us. The work that we're going to be discussing today, and you'll hear about this from Mike, started with John A. Hartford Foundation funding to the National Alliance for Caregiving in partnership with the National Association of Chronic Disease Directors to ultimately develop a framework for policy recommendations and implementation strategy, and then also messaging content aimed at enhancing the national caregiver support infrastructure through this public health lens. Its focus was on caregivers of people with chronic diseases, including, as one of them, dementia. And our foundation supports a number of other initiatives as well to support dementia caregivers, which is why this is such a great partnership. We co-funded the creation of Best Practice Caregiving. For example, that is an online resource of the Family Caregiver Alliance and the Benjamin Rose Institute to help healthcare and social service organizations select those evidence-based dementia caregiving programs. And separately, we have a major initiative called Age-Friendly Public Health Systems. And that is a partnership with Trust for America's Health, where we're working with local and state public health departments across the country to better support health and well-being for all of us as we age. The Age-Friendly Public Health Systems Initiative can serve as a platform on which to build out the framework you'll hear about today and to move it out into communities, because we really want to be action-oriented. I have to mention one other platform, important platform, and that is the Recognize, Assist, Include, Support, and Engage Act, or the RAISE Act. And if you haven't already, please do look for the recent RAISE Act Advisory Council report to Congress, which has 26 different recommendations to support caregivers. It's not specific to dementia, but you know these things fit. And those recommendations are ultimately to help advance the efforts that are being discussed today. So a national strategy for all sectors will be released next year, and each of you can promote and take advantage of that strategy and the momentum that it's building to support caregivers who are really, as we all know, the backbone of care in this country. So I'm going to close just by saying we have this powerhouse panel today that Joe mentioned that I can't wait to hear. Mike, Heidi, Sandy, and Robin, and the organizations they represent are longtime partners of ours at the foundation as well. And I can't thank them enough for what they do. And thanks so much, Joe, for your leadership and Alma's. And with that, I will turn it back to you and to Heidi for the next part of the agenda.
Thanks so much, Ronnie. So appreciate it. Thank you for being here too and all of your support. You know, before we begin, I think it's important for us to acknowledge the land. The University of Minnesota Twin Cities is located on traditional, ancestral, and contemporary lands of Indigenous people. We acknowledge with gratitude the land itself and the people. We take to heart and commit through action to learn and honor the traditional cultural Dakota values, courage, wisdom, respect, and generosity. I think all of these values you will hear very much intertwined throughout our panel discussion today. So really quickly, an overview of the Bold Public Health Center of Excellence on Dementia Caregiving, as Ronnie had mentioned, and as we are so grateful to the Centers for Disease Control and Prevention support and coordinate and provide oversight to this particular center. And our center is really designed to support tribal, state, and local public health agencies nationwide in helping them develop their dementia caregiving focused programming, initiatives, education, outreach, et cetera. And we really do it vis-a-vis these three ways you see here on these checkboxes. You know, in the end, I think our center really serves as a gathering of experts, but then also as a resource to everybody. Public health organizations in particular, but also beyond that, to help support and advance how we educate, how we serve, and how we develop and disseminate and implement services, evidence-based programs to best support unpaid caregivers of people living with dementia in the US. So here's our panel here today. As I had mentioned, we're just really thrilled and honored to convene them here today and to discuss, again, why dementia caregiving is a pressing public health priority. We have Mike Wiki, who's the Vice President of Research and Advocacy for the National Alliance of Caregiving, Heidi Holt, who's a public health advisor for the Alzheimer's Disease and Healthy Aging Program of CDC, is also the program officer of the Bold Public Health Center of Excellence on Dementia Caregiving. Sandy Markwood, who's a Chief Executive Officer of US Aging. And then Robin Stone, Senior Vice President of Research and also co-director of the Leading Age LTSS Center at UMass Boston. All of these individuals are part of our center. All of them are great experts, and we're just going to learn a great deal today about the public health ramifications of dementia caregiving. Thank you all. We'll be saving questions and answers and discussion for the end of the presentation. If you have questions while our presenters are talking, feel free to use the Q&A tab or the chat option, and I'll be moderating and I'll be delivering questions at the end of our presentation. So thank you, everybody.
Okay.
Fantastic.
Go ahead.
Thank you, Elma. So I'm Heidi Holt. I'm with the Centers for Disease Control and Prevention in the Healthy Aging branch. And I'm happy to be here today to talk to you about dementia caregiving and its importance to public health. The CDC has many different initiatives that are leading towards public health and dementia, our National Healthy Brain Initiative, as well as our building our nation's largest dementia public health infrastructure, or BOLD. One of the main parts of BOLD, or one of the main goals of BOLD, is to elevate dementia and dementia caregiving as a public health priority. And so this webinar today is extremely important to us. We fund currently 23 states, local, and tribal programs, 3 public health centers of excellence, and 4 National Healthy Brain Initiative national partners to engage with us in this effort. So what is caregiving, family caregiving. The term family caregiver means an adult family member or other individual who has a significant relationship with that person who's having care. And these are oftentimes people who are dealing with different chronic conditions, one of which is dementia, but also and anyone who's providing assistance to enable the person, their loved one, to be healthy and through their illness. There are over 53 million people in the country who are over 18 who are caregivers. And they may not think of themselves as caregivers, but they may just think about helping or family duty to help their loved ones and their neighbors, but they are caregivers for the purposes of what we're thinking about them for. Next slide, please. So caregiving is a public health priority. Caregivers for multiple reasons. One of which is that they play a critical role in the health of the person with chronic conditions, especially for older adults, keeping them out of institutional settings and making sure that their appointments are met and their health is considered and that they're getting the care that they need. The reason for providing care is usually either mobility issues or dementia, Alzheimer's disease, cancer, mental illness, stroke, diabetes, heart disease. There are several reasons why, but there are multiple reasons. And an increasing number of caregivers struggle to balance the cascading issues that result for caring for people with multiple conditions. And an increasing number of caregivers are having difficulty coordinating care, but they're also having difficulty keeping up with their own health, which is another reason this is a public health issue, is that the burden of keeping up with all of the details of a loved one's care, they often forget to care for themselves. And so it is a public health concern, as well as, and sometimes we think of this as it's another social determinant of health, is their status as a caregiver. Next slide, please. So caregivers themselves, like I said, are an at-risk population. Some of them already have one or more chronic, two or more chronic diseases. They've said oftentimes that as they care for others, their health gets worse. And over half of caregivers indicated that decline in their health compromises their ability not only to care for themselves, but also their loved one that they're caring for. Next slide. So what's the difference between caregiving and dementia caregiving? Why focus on dementia caregiving? About 1 in 3 of those caregivers are caring for people with Alzheimer's disease or dementia, and they report worsening health. Approximately 1/4 of dementia caregivers are sandwich generation caregivers, meaning that they not only care for an aging parent, but also for their children who are under 18. Compared with caregivers of people without dementia, twice as many caregivers indicate of those with dementia indicate substantial emotional, physical, financial difficulties that are over and above caring for someone without dementia. And another piece of this is that this total lifetime cost of caring for someone with dementia, 70% of it is borne by families, and either through out-of-pocket health or long-term care expenses. And this causes an issue with the ability to continue caring for someone in a quality way over the lifetime. Next slide. So public health agencies can play a unique role in promoting and understanding action aimed at improving the situations of caregivers and dementia caregivers across the country. They can link dementia caregivers with services like those provided by area agencies on aging and focus on improving systems so that dementia caregivers are recognized, supported, and included not only in the caregiving and care planning for their loved one, but also in care planning for themselves. And this coordination is critical to their ability to adequately and fully do the jobs that they need to do without trying to hunt down and connect things themselves. So promoting understanding and forming linkages to improve the coordination of services, to sustain the coordination and services, to link those to providers and find the way through the system is extremely important and a great way for public health to add value to the work already being done across the state. So with that, I will turn this back to my Wiki.
Great. Hi, everybody. First, I just want to say thank you to Joe and Ronnie for their support around this project, and as well as Heidi and Sandy and Robin for being here today to discuss this issue in a meaningful way. And thank you to all of you for being here and spending your time with us. So my name is Mike Wiki. I'm the VP for Research and Advocacy at the National Alliance for Caregiving, and we've been around for over 25 years focusing on issues related to family caregiving through the lens of research, advocacy, and innovation. And specifically through our policy and advocacy work, we put a concerted effort, and this is something that we really just defined in the last couple of years here, to revamp the strategic mission of our advocacy and policy work, which advances caregiving as a public health issue, but also builds awareness that fosters a national conversation that'll empower caregivers to thrive at work, home, and in life in general. And to tell you a little bit about what that means, I want to just share a quick story that really stood out to me from one of the caregivers we worked with recently as it relates to this project specifically. So in 2011, Jennifer, a caregiver that we worked with, noticed her in Florida. She's actually involved in a pilot project that the Trust for America's Health is doing that was mentioned earlier by Ronnie. She was caring for her mother. She's been caring for her mother since 2011, and she noticed that her mother was having trouble with short-term memory issues. But over time, her mother's condition escalated to include paranoia, getting lost or easily confused, suffering from hallucinations, and making calls to 911 to report serious crimes that actually hadn't happened. She was also leaving the home for days on end without telling anybody where she was going. And it got to the point to where during the COVID-19 pandemic brought out new concerns that Jennifer was dealing with in caring for her mother, because at this point her mom had been placed in a facility, and Jennifer noticed that her mom was her condition had been increasing or had been getting worse over time, and since visits to her mother's assisted living facility weren't allowed, Jennifer wasn't able to witness the care her mom was receiving and wasn't informed of those health changes. So because of a hospitalization that had occurred, she realized that her mom had become completely incontinent. And when the staff had when she asked the assisted living facility about it, they commented that her mother really needed plastic mattress pads, and she had been worried that her mother had been laying on soiled mattress for months. So Jennifer was really surprised by the insensitivity that she encountered by specialists, and she felt that healthcare providers and community services need systemic improvements on aging-related social issues and health conditions. And she feels that education for social services needs to be focused on caregiver needs, how to obtain in-home care for families to be able to care for their family members in a safe way, and how to help them financially plan and manage for the expenses related to caregiving. So that's a story that really, is connected to what we're trying to accomplish here through this work. And again, thanks to support from Johnny Hartford Foundation, the National Alliance for Caregiving, along with the National Association of Chronic Disease Directors, developed a policy framework for recommendations, an implementation strategy, and messaging content aimed at enhancing the national caregiver support infrastructure through a public health lens. So the framework identifies appropriate mechanisms that caregivers and practices that can be implemented to support caregivers via entities such as chronic disease directors, but also those others in public health, and oftentimes in coordination with community-based organizations who typically deliver long-term services and supports and home and community-based services. So the activities that took place during the first part of this project, we surveyed all 59 chronic disease directors from all US states and territories to gain an understanding specifically how that network of professionals within the public health ecosystem are currently serving family caregivers and how familiar they are with existing programs. So in addition to the survey, we held 2 focus groups with some of those chronic disease directors that we surveyed to take a deeper dive into how caregiver services and supports would look when implemented, what messaging tactics we could be implementing, and what we can be doing to better improve data collection efforts. And finally, we held a thought leader roundtable of distinguished experts in public health, aging, chronic disease, and caregiving to explore how data collection, messaging, and service delivery would be best implemented, and how to ensure that public health leaders prioritize the recommendations outlined in the framework. And so just a little bit about the framework before I move on here to the next slide is the survey was done as one complete survey, but it was administered in 3 different phases. So the first phase was a survey to states that was conducted in October of 2020. And then we did a follow-up survey to those states in December, and then a pulse survey conducted in November. Sorry, the pulse survey was conducted in November, and then the follow-up survey to states was done in 2020, so that we could ask questions that were built on one another and get additional information based on information we felt like we weren't able to collect in the previous surveys. Okay, so public health agencies, private and nonprofit and governmental partners at the national, state, and local level can work together on actions to make caregiving the next public health success story in a way that considers the needs of the care recipient, but also the needs of the caregiver and their health and well-being. The importance of this issue is really particularly timely as of the COVID-19 pandemic, because the pandemic further underscored this issue and the need to ensure caregivers are brought out of the margins and into the mainstream when it comes to providing them services and supports to not only be able to care for the person they're caring for, but also their self. And the ability for them to do this effectively will really depend on how we as a society formally recognize them as key contributors, integrate them into formal systems, and provide support to them that addresses their risk factors. So you can go to the next slide. So the framework elements that we created here under this coordinated public health approach is under 2 tiers. One is on the more focused on the national level, and one's more focused on the community level. And we'll get into these tiers in more detail through the upcoming presenters. But just to give you a little bit of a high-level overview of how we came to these components. So we looked at the role of public health in data collection and dissemination. So public health uses data to call attention to the needs of population health issues and interventions on a regular basis as it is. And so collecting data on caregivers and their needs can help prioritize public health actions and appropriately allocate resources and capacity. We can be doing this by improving data collection on caregiver health conditions and risk factors, and also looking at improving ways we can improve data collection on caregivers of those with comorbidities. And we want to make sure that that data is collected on a consistent basis. The next part in that national level tier is around public health awareness. And so through its public communication channels and networking channels, and public health can improve community-wide awareness and access to prevention and health promoting programs and services. The elements of this framework that I'm referring to right now throughout actually closely align with that initiative that Ronnie mentioned earlier that Trust for America's Health is doing. And a lot of the framework that they have laid out in terms of how caregiving and public health works actually very closely aligns with the work that we're doing here. And so some of the language that I'm using to refer to the role that public health can provide, I've borrowed from some of their language to be able to help kind of describe this as well, so that I'm working in coordination with other efforts that are happening in the field. So on tier 2, when it comes to community level type activities, we're really looking at service coordination and education and training as 2 big components that can be improved upon. And again, these are areas that connect with that framework that I mentioned from Trust for America's Health, where connecting and convening multiple sectors is something that public health departments excel at in terms of bringing together multi-sector stakeholders to address health and social challenges. And so this is an area where public health really already kind of has a strong place to a role to play. And then in terms of education and training, the services that public health can provide really can help raise awareness across different sectors, as I mentioned a second ago, and bring the right tools in the right places where caregivers are entering into the system. Okay, so you can go to the next slide. Okay, and so this is where I pass it back to Heidi to describe a little bit more about that first tier. One of the components in the first tier, data gathering, reporting, as well as public health awareness. Thanks. You can take it from here, Heidi.
Thanks, Mike. So, so just a little bit about the data collection and what the status of things that are happening. One of the ways, of course, like Mike said, we can find out more about caregivers and is to discover more about them through data collection. The problem is that a lot of the data collection is very inconsistent, and also many caregivers are not recorded on electronic health records, or their status as as caregivers aren't collected. So many national surveys, when asking about health conditions, don't ask about their caregiving status. So we need more national level data collection across all the 50 states on a consistent level. It talks about caregivers, health conditions and their risk factors, and really just better information overall to make better decisions. We need evidence-informed and peer-reviewed studies on caregivers and what they face on a daily basis, and how that relates to their social determinants of health, health equity, and effective interventions. Next slide. One of the ways that we do that is through the Behavioral Risk Factor Surveillance System, or BRFSS. And for those of you who are not familiar with it, it's a nationwide telephone and landline survey that collects state data about U.S. residents regarding their health-related risk behaviors, chronic health conditions, and use of preventive services. It's a very broad survey. It's run by CDC and conducted by individual state health departments. Next slide. One of the ways that we can learn more about caregivers is through a question set like this. And I know there's a lot of words here, but this you don't have to read all of them. But this is a set of questions for one of the optional BRFSS modules on caregiving. The Caregiver Module has 9 questions, and the data can provide you with information you need to help make decisions about programming in your state or jurisdiction. It can also give you information that can help make the case for decision makers to provide support for activities that support caregivers, including dementia caregivers. There's questions in here such as how long have you provided care and what is the main health problem that the person you care for has. These can help define the population in your state and help with priority setting. Next slide. This shows a map of the states that have administered the caregiving module from 2015 to 2020, which is the most recent year we have. And it shows that some states, not all states do this survey every year, and some of them haven't really done the survey since 2015. The goal here is that adding questions to the BRFSS sometimes takes time and money, and the survey has a limited time frame that they know they can keep people on the phone. So the goal is to make sure that at least every couple of years that a survey like this is done, so that we can have an adequate picture of what caregivers are experiencing and the number of caregivers in your state. Next slide. We need to use this data in a way that can help us create awareness and convince priority setting decision makers to act on the needs of this population. The value of the caregiver in the chronic disease management of their loved one, and the unique experiences and challenges that each caregiver has with regard to their own health. We need to ensure with information like this that public health and healthcare sector professionals are targeting their efforts towards the population that is the most of need. and recognize that caregivers are an essential part of caring for people through emergencies and response activities. So, and then of course, employers need to understand as well that if many of these caregivers also hold full-time, part-time jobs in addition to caring for their loved ones, and that policies and organizational policies can help make sure that those people are supported through their journeys to enable to still take care of themselves while they're taking care of the loved ones. So let's go to the next slide. So one of the ways that we can help bring that awareness is by using BRFS data and other data in ways that are simple to understand and easy to absorb. The CDC and the Alzheimer's Association both analyze BRFSS data from across the country, and every state analyzes their own data as well. And we've developed several different types of infographics as a service to those states and to national decision makers. We have both national and state infographics on various subjects. The one on the left is the Alzheimer's Association infographic on dementia caregiving. This one happens to be about Maryland. I don't expect you to read it, just to know that it exists, and one for every state does exist on the alzheimers.org website. The one on the right is a CDC infographic. This one is using Hawaii data, but it shows you that it's a graphic representation of the results of that caregiving survey, BRFSS. The CDC also provides infographics for populations of high burden, such as African Americans, American Indian Alaska Natives, Asians, Hispanics, and states can use their data as well to produce similar, easily understood information to share with their partners, decision makers, and others. And it can be used this data can be used in many different ways. Connecticut, for example, Connecticut provided testimony to the Aging Committee as it heard evidence on proposed respite care. Kansas educated state legislatures about dementia and caregiving issues. Louisiana developed training for supervisors at the Louisiana Health Department to support employees who are caregivers. And New Jersey used data to set the ground for long-term legislative infrastructure for dementia caregiving. So things like this are very useful in creating awareness within the data. These are just a few examples, and I'll give you one more. Next slide, please. We have the CDC on its website has 5 different state of aging and health in America data briefs. These are another great resource for planning and priority setting. There are a series of topic-specific documents that the National Association of Chronic Disease Directors helped us with that focus on health issues related to older adults. This brief is about caregiving for family and friends. They provide the most recent and most relevant data on health and aging, and include breakdowns by state, age, gender, ethnicity, and people have found them very useful in helping make informed decisions. This caregiving data brief includes action items as well that you and your community can take to make changes that positively impact caregivers, and it includes the most recent and relevant caregiving data that's available. And you can find this at our website, cdc.gov/aging, under the publications tab. So I will turn this over to Sandy Markwood.
Great. Heidi, thank you so much. And again, I also want to give my thanks to Joe and for the support of Ronnie Snyder and the John A. Hartford Foundation, and also really want to commend, Heidi, you and your colleagues at CDC, and really focusing in on the important issue of caregiver as a public health priority. And quite honestly, I think caregiving is now being recognized as a national priority because of all of the statistics that are out there about, 1 in 5 Americans being a caregiver, but that is reinforced by the fact that 1 in 3 of those caregivers is really a caregiver of someone with dementia. And those caregivers are the most stressed and the most stretched of caregivers that are out there. But in looking at meeting the needs of caregivers, I really wanted to focus in for a few minutes on service coordination. It's how we respond to the needs of caregivers. And we need a systematic approach to that, a systematic approach to service coordination for family caregivers across public health, but also across healthcare settings. And in looking at that systematic approach, it has to be one that is person-centered, one that is family-centered, and one that recognizes, quite honestly, where most health happens, which is at home and in the community. So as we're looking at service coordination, being able to identify community level entry points for caregivers, and to be able to recognize those points early on. As Heidi mentioned and Joe mentioned in the introduction, I am with US Aging, and US Aging used to be the National Association of Area Agencies on Aging, and we recently changed our name. And we changed our name because of the expansiveness of what area agencies on aging are doing across the country. And we also are so proud to be the voice in Washington for the more than 256 Title VI Native American aging programs that are serving Indian elders in Indian country. So in saying that, the work of area agencies on aging should be partners with public health, and are in so many communities partners with public health on so many different issues, but caregiving needs to be one. So when we're looking at identifying community level entry points for caregivers, I would encourage everyone, if you don't know or haven't connected with your area agency on aging, or your Title VI Native American Aging Program, that you do so, because you are connecting then not only to those entities, but also to over 20,000 aging service providers that they contract with at the community level to be able to meet the needs of older adults as well as caregivers. So in looking at what those community level entry points could be, it could be a senior center, it could be an adult daycare center, it could be a whole range of different options. But again, from an entry point, I'd encourage you to contact your area agency on aging, because they can guide you and also coordinate those efforts. But it's also important to understand public health department's role in coordinating caregiver services that can be done in partnership with community-based organizations. And there's a number of those. And I think COVID has really highlighted the importance of the partnership between community-based organizations, area agencies on aging, as well as other community-based organizations and public health. And those coordination roles are key and critical. Area agencies on aging have a direct line to so many caregivers because they operate the National Family Caregiver Support Program, which provides education, it provides support services and respite services to caregivers. But that is also a line, an opportunity for public health to be able to coordinate the important services that public health provides with the social services. And Heidi mentioned the social determinants of health that have always been the sweet spot of the delivery system of community-based organizations like area agencies on aging. But also ensuring that caregivers of those across the range of conditions are identified, assessed, and referred to services as they go through their caregiver journey. And a caregiver's journey, especially with an individual who has dementia, Alzheimer's or other dementias, is certainly a journey. And I can say that both personally and professionally. That once you get that diagnosis, oftentimes the other part of this is that there is a stigma on reaching out and getting the support and planning for the services and supports that people are going to need over time. And that's key and critical. So being able to ensure that we identify caregivers. So when they walk into a community-based setting, or their care recipient does, to ask that question, are you caring for somebody? Do you need help? when they walk into a public health office, that you ask those questions to identify and try to assess their needs, and if they need supportive services, and if they don't yet, but will likely need them down the line, to make sure that they are aware of the community services that are out there to assist them. And ensuring caregivers of all chronic and serious conditions are eligible for services. And as Heidi pointed out, that recognizing that from a public health perspective, as well as from a social services perspective, that caregivers have illnesses as well. They have conditions, and that if they are in stressful caregiving conditions, those conditions can worsen. So it's really incumbent upon us, as we're looking at meeting the needs, the health needs of caregivers as well as their care recipients, that we do that level of outreach. And I just wanted to highlight a couple of statistics from the ACL evaluation of the National Family Caregiver Support Program. These aren't specifically tied to dementia, but I think they reinforce the importance of the public health dimensions of caregiving. One is that 79% of caregivers of people in the National Family Caregiver Support Program are responsible for caring for their loved one 24 hours a day. Talk about stress. 81% perform medical tasks, and 57 report being socially isolated. And we all know that those have major impacts, all three of those things, on the health of a caregiver. Next slide, please. So as we look at education and training for caregivers is key, because no caregiver ever expected to be a caregiver. They were never trained to be a caregiver. And they find themselves in this position and oftentimes don't even identify themselves as a caregiver. They identify themselves as a good son, a good daughter. Of course, this is what I would do for my mom, for my dad, for my loved one. So in saying that, we need to ensure that we implement educational programs for caregivers across all conditions that allow them to be able to have a care team and to complement clinical visits. Because really what we need to do here is to build a bridge between clinical care and the care that happens at home and in the community, between public health and healthcare and the social services support system that needs to be there and needs to be the fabric to be able to support both the caregiver and the care recipient. And secondly, to be able to establish a cross-collaborative effort among community-based organizations and public health departments, so that we are really expanding upon the existing caregiver programs that are out there, and also looking at new caregiver programs that are needed and necessary. You know, and I look back at the COVID crisis, and one of the issues that has come to the forefront and been spotlighted is social isolation and loneliness. Well, we all knew that that was there before, but it has now been spotlighted in the impact that that has had during the COVID crisis, not just on older adults or older adults with dementia, but also on their important care partners too. So we need to look at new and different ways to respond to the needs of caregivers moving forward. And finally, looking at collecting data on service usage to understand how to assess the services that caregivers need, to be able to track the outcomes of what works best, evidence-based programming in this arena, and also to recognize that there are racial and health disparities that impact not only the care for the care recipient, but also for the caregiver as well. And in saying that, again, I would just like to close by saying that there are really important reasons for doing education and training. And again, I'd just like to highlight a couple statistics, again, from the National Family Caregiver Support Program, which found that when caregivers got information and assistance, that 60% said that they could care longer for their loved one. 71% reported that it reduced their stress, and 80% said that it assisted them to be a better caregiver. So this is something that we need to do. We need to ensure that public health, that as a nation, that we all come together to support our nation's important caregivers, because as Ronnie said at the beginning, they are the backbone of the long-term care system in this country. So with that, I will turn it to Mike.
Okay, thanks, Sandy, and thank you, Heidi. Before we turn it over to Robin and have a little bit more discussion around the framework and how these recommendations can actually look when implemented, I just want to highlight a few things within the national landscape. Some of this RAISE Family Caregiver Act was referred to earlier, but a couple other things I want to highlight before I get to that is, first of all, the Biden administration has really placed the needs of family caregivers at the center of its domestic policy agenda. Helping caregivers has not only been a campaign promise for President Biden, but his administration has placed them at the center of the American Families Plan and the American Jobs Plan, and called for increased funding for caregiver supports in his presidential budget. And we have been encouraged to see the amount of attention that's been drawn to this issue because of that, the language that the White House is using around how critically important it is to support these families as an effort to really our national recovery, not only coming out of the COVID-19 pandemic, but also addressing some of the just societal disparities that we have that are being placed on people because of situations that they're being placed in to be able to fill gaps of care. And then I mentioned the COVID-19 pandemic has made society more aware of the contributions that family caregivers provide. The deliverables involved in this project offer a foundation for a more in-depth process of creating a detailed multiple-year public health roadmap for family caregivers, and an infrastructure for public health that includes and understands the needs of caregivers, and will be better prepared to interact with them during other public health emergencies. And then finally, the RAISE Family Caregiver Act established a RAISE Family Caregiver Advisory Council tasked with creating a national strategy on family caregiving, and is expected to release the national strategy potentially in 2022. Many of the recommendations from this project align with some of the RAISE Council recommendations that were included in the initial congressional report that was made public just 2 months ago. This report will likely serve as a vehicle to begin to work on some of what implementation would look like from that national strategy. So as that national strategy is being finalized, we see this as a starting place to better integrate family caregivers into public health systems, and really what we're trying to accomplish here is to be able to establish a support infrastructure that reaches caregivers across the range of conditions. Most importantly, because of the sheer size of those who are caring for people with Alzheimer's and dementia, but also people who are caring for those with cancer, ALS, stroke, heart disease, etc. And this approach not only recognizes the contribution that caregivers make to those with chronic conditions, but also views them as a potential at-risk population. So with that, I'll turn it over to Robin for discussion and reactions.
So thank you. This has been a fantastic presentation. I want to thank everybody, including certainly the Public Health Center for Excellence, of which I am part as a part of one of the stakeholders, and also the NAC and Hartford Foundation, and my wonderful panelists that are here with me today. I think they gave me this task partly because I'm a seasoned public health person. I actually graduated with a public health degree. My doctorate is from a public health school 35 years ago. And I can tell you that there was nothing in aging in our curriculum whatsoever. I had to cobble together my program and took courses in other schools. And it was, to me, a travesty, given that even before I went into my doctoral program, I had spent many years working in aging services. It's about time, and thanks to the Hartford Foundation and everyone else that is beginning to make public health aware of the needs of older adults, and now also their family caregivers and partners. So I want to just sort of do what I think are some of the takeaways around how important public health is to helping to support an infrastructure for family caregivers, for people living with dementia across all of the dementias, from early onset all the way through end of life. And having said that, I would also indicate that I represent Leading Age, which is a national association of 6,000 not-for-profit aging services providers, ranging from independent living and market rate and affordable senior housing to nursing homes, assisted living, home health, home care, adult daycare, transportation, the whole range of services that are provided out there in communities across the country. And during this pandemic and during COVID, the heavy surges of COVID, many of our organizations had very strong partnerships with local public health departments. Others had very weak partnerships with public health departments and hardly heard from public health. And for me, the challenge for us going forward is to make older adults and their caregivers a normative part of the public health process. And even before we get to these 4 areas of talking about this, we need to need to strengthen the capacity of public health departments, not just at the state level, but really at the local level. We need to have specialists in every single public health department that understand the specific and special needs of older adults and the families that are caring for them. This is essential. We then need to think about how we do these 4 different areas, which I think are important and unique to public health. The first is there's no other entity in this country that should be doing the kind of surveillance that is the responsibility of public health departments across the country. As a public health person, that's a lot of what we have focused on over the years. And so we need to have good surveillance of the older adult population and the caregivers that are providing assistance, particularly for people living with dementia. This is going to be a very fast growing disease over the next 20 years. If you are 85 years old, you have a very high risk of having some level of dementia. And most of these folks are not living alone. They have caregivers. So this is a growing need in most of our communities around the country. The surveillance is essential. We need to have periodic data collection. And I would argue that in addition to collecting the births, we need to start thinking about how we collect good standardized data on the older adult population and include modules there that collect specific information on who are their caregivers. That is the best way to get to caregivers in the community, starting with the individual. And then you actually can link the data between the caregivers and the older adults, people living with dementia, and can really make some population analyses, which is the goal of public health. Public health is really focused on the public. It's a population health approach. And I think we have great opportunities for gathering data, reporting, but also using those data in our communities to target specific interventions. That is something that no other organization can do. We are trying to push some of that off on managed care plans and ACOs around the country. But truth of the matter is, they don't have the capacity to do the kind of public health work around social determinants of health and interventions that public health departments do. So we need to be gathering those data, not just because we want them, but because we are going to use them to target interventions and initiatives around the country. The second incredibly high role, as we talked about before, is public health awareness. How did we get rid of people smoking all over the place? This was the best, the most amazing public health success in the 20th century. And that came through public health. And I think we need to be thinking about people living with dementia and their caregivers at that level of public health awareness. It's happening through healthy aging communities and a lot of other efforts, but we can do even better in terms of thinking about the role of our organizations at every single level, whether it's national, state, or local, in terms of getting that awareness out. I've been really, really worried about emergency response. I'm on the National Academy of Medicine, and one of my partners on our health science policy board was the director of the public health department for Harris County in Houston. He did a major report for us at the National Academy on what they were doing in response to Hurricane Harry. And I was really upset by the fact that there was hardly any specific clear emphasis on older adults and their family caregivers. And yet these are the people that are most likely to have horrific impact from these types of emergencies. And it's not only in response to the emergency, it's in prevention, it's in planning, it's in educating families and their care and the people they're caring for, why they should be worried about these things way before they happen. Do they have everything around? I saw that Heidi put the information on where you can find tools for older adults. Truth of the matter is those older adults don't often use those tools. Sometimes they do, sometimes they don't. So the public health departments need to be focused on emergency preparedness in addition to response, and the education piece of this, not only educating the people with dementia and their caregivers, but quite honestly, primary care physicians and other organizations, other health providers that are the front touch, the social contacts with these individuals. Sandy, I said, did a remarkable job on talking about service coordination and the important role of the AAAs. They are a fantastic partner for public health departments. And I think one of the things that is going to be important as you all move forward is to think about how to not be redundant. We don't need to be creating additional case managers around service coordination and identifying social determinants of health. We need to be working together, and the public health departments at the state and local levels can be filling gaps that organizations like the AAAs and organizations like mine cannot do. And as I said, if you think about the role of public health, we are all about social determinants of health: clean water, good food, poverty, poor housing. These are public health issues. They're not health system issues. And we need to take back and focus much more on how we help populations to address social determinants of health, including working on some of these initiatives and making sure that these populations are not subject to many of these kinds of challenges, particularly in areas of neighborhoods of significant vulnerability. And finally, I would want to say again, I think this education and training is an area where public health can do some of the best work that they do. I went to school with a lot of public health folks. I myself was trained in policy, but there is nobody better than a public health educator to do the kind of education and training, not just the training, but how do we motivate people to actually use the informed evidence-based programs that we are growing all the time, addressing caregiver needs. So thinking about using public health educators in a much broader way, working together with the AAAs, other CBOs, and other organizations to make that happen. I'm just thrilled that we've had this webinar, and I'm thrilled that public health departments and CDC and everyone at every single level are finally paying attention to this population. And the persons living with dementia and their caregivers are essential in this equation, both as a dyad, understanding them as a team, and also understanding the unique needs of the caregiver population itself. And thanks, Mike. And I'm gonna turn it back to you or Joe. I think Joe is now going to be sort of fielding Q&A.
Yep, I think I'm up here. So everyone, thank you. Wow, this was an incredible panel. I mean, my goodness, I learned a lot. I think the theme of all this is many of us have worked together. We are working together, and we can't address the issue of dementia caregiving as a public health priority unless we continue working together, even in even deeper, richer ways, and learning from each other and figuring out how we can contribute to addressing this, I believe, amongst really one of our most pressing public health concerns at present. The other thing I want to comment on, we had great attendance here today, and the audience has been great. There are some superb questions that came through, as well as comments. And in our remaining time, I'm going to take the opportunity to start moderating some of these for our panel. And I'm going to start with Alicia Newman. She had a really good question here. It's my understanding that in the US, a lot of health services and now increasingly social determinants of health support services are coordinated by Medicaid and Medicare managed care organizations. However, in many cases, they don't have the family caregivers as members, only the care recipients, which creates barriers for identifying caregivers and supporting them. What do you see as medical care organizations' roles in the context of family caregiving as a public health issue? Robin, I think you talked a little bit about that, but maybe you want to expand a bit, as well as some of our other panel members.
This is a hard one because I've been, I'm old enough now that I can pretty much say what I want without getting too much retribution. But I've been a little concerned that so much of the responsibility for social determinants of health is being put on the medical care system and payers, because the truth of the matter is that the expertise around social determinants of health lies with community-based organizations and public health departments. And so I think if we can do a better job of surveillance, particularly at the state and local levels, and help to identify these target populations of high need, and then work with managed care organizations to actually match their members with these targeted areas. This is another way to start to get at the caregivers as well as persons living with dementia. I think there's limits to what we can expect MCOs to do by themselves and even through their current contracting with CBOs. I think the public health infrastructure needs to be there to support not just the MCOs, but also the folks who continue to be in fee-for-service Medicare, which is more older adults than those in managed care organizations. So for public health, it's a broader issue than just the MCOs, but I see the MCOs as being a partner in this. And
Great.
I don't know, Sandy may have some ideas too, because a lot of the AAAs are working with the MCOs these days.
Yeah, thanks, Robin. I think that I'm hopeful. There's certainly, we are not where we need to be, but I have seen a number of managed care organizations, as well as, with the supplemental benefits, Medicare Advantage programs, looking at and recognizing that the important role that caregivers play in meeting the healthcare needs of the care recipient. So even if they are not in the system, looking at ways to be able to contract with area agencies and other community-based organizations to do a level of support. The issue always is, one, a recognition, but two, being able to have a payment system that can flow through the healthcare system to a community-based organization to provide the level of supports that are needed. So that's something I know, Robin, and you've been such a champion for this, but something that we need to continue to work on.
Great, thank you both. Really appreciate it. Mike, I'm going to direct this next question to you. This comes from Sally Steiner. Is there a report on the NAC surveys?
On the NAC surveys?
Yeah.
Yeah, so that's actually the next step of our process here, is we're taking all of this information that we've gathered through the surveying and through the focus groups and the roundtables and all, and really like our literature review and all that stuff, and putting it together in a really, a public facing document that's easy to read, talks about some of the rationale behind this work, shares some, kind of brings all the stuff that we talked about in this presentation today together in one kind of digestible form. That we're expecting that to be complete springtime. And then we're going to be sort of rolling that out on an ongoing basis throughout the remainder of the year and beyond.
Wonderful. Thank you, Mike, so much for that. Appreciate it. I know many of us are very interested in that.
Thank you.
Next question I have is from Kim McCrae, and I'm going to first direct this to you, Heidi. And I think maybe others on the panel would like to weigh in. It would be great if the language was dementia on questionnaire and not Alzheimer's, or some way to get at all of the dementias. So Heidi, I wonder what your thoughts are on that one. That's a good question.
It is a really good question. And I think the decision behind that is something that I wasn't part of, but I think one of the ways that we've been talking about dementia is to just use the term Alzheimer's disease as the term we use, because most of the dementias out there are Alzheimer's disease. There's been a lot of public education already about that term and about that version of dementia, but that's not the only thing we collect on. So when we do talk about Alzheimer's disease, we really are talking about and related dementias and other dementias when we do that. So I think that what we have, the question when we talk about it in the surveys is broader than just Alzheimer's disease.
Okay, thanks, Heidi. And while I have you on, Heidi, I think the next question, I think you could maybe start with too. This is something we've talked about a lot in our center. This is from Megan Wolf. Are there any examples of state data platforms that include caregiving stats and or caregiver health?
That I'll have to defer to answer after the call. I don't have any specific information about specific state data platforms.
My impression is no, but I could be wrong. Robin, what do you have? Yeah.
I would say the one place where you can find some of this, and it's not for all populations, but it's a lot of the state long-term services and supports assessment tools collect information on caregivers as well as the people who are being served. So
but for a segment of the state population.
So if you are interested, and I believe that it is a very important population because it really is this long-term services and supports population where dementia is prevalent and where your caregiving really gets intense. And there, many of these state tools have data that are collected on caregivers as well as the people who are being served. But it is a subset. It's not everybody in the state.
One of our great goals, Megan, and I don't know if we're ever going to achieve this in our center, I would love one day to actually create a caregiving map. You know, like you've seen other chronic conditions where they'll show a state map and it will show you in which county there's the highest prevalence of cancer or this disease or that disease or this condition. And I would love to be able to do that for caregiving, and specifically dementia caregiving. We're starting exploration of seeing if there are data sources out there that can allow us to do this with RTI, but it's at the very beginning stages. And I can't promise you anything, but I think we're on the same wavelength of it would be great to have that kind of granular information, particularly for departments of health. So
Joe, one of the things that I can say about the BRFSS is that states have the ability to take that data and analyze it in a different way than CDC can in terms of taking certain pieces of that data over time and getting enough of an end value to actually make some decisions and reports on. So I think it's very possible that would be a way of finding more out about counties in specific, but again, you have to have enough data to be able to pull those percentages out. So
right now the BRFSS I think is the best source for any kind of state level information on caregiving,
right,
as far as I can tell. So Sandy, I'm going to direct this next one to you. This is a good one from Florence Johnson, and I think you addressed this somewhat in your presentation, but when she posed this question, it was a little bit earlier in the talk. I may be jumping ahead, but is there data on support services use, barriers and facilitators for caregivers? And maybe this is for you a little bit too, Heidi. I think what Florence was getting at is, do we have good data on the amount of services caregivers actually use? What are barriers and facilitators to that use, et cetera?
I can speak to the National Family Caregiver Support Program, Joe, that collects information on the usage of that program, who's using it from a caregiver perspective, what their outcomes are, what additional barriers that they face. And then again, the beauty of that program is that it allows a great deal of flexibility for the area agencies on aging to meet the caregivers' needs, to be person-centered, family-centered on what they need. But in saying that, it captures their needs. So there is a whole evaluation of that program on the Administration for Community Living's website. And so I'd encourage you to take a look at that if you want to see the data that is captured through that program. We also at US Aging capture information in surveys of both area agencies on aging and Title VI programs of who they're serving and how they're serving. And for instance, for people who are clients with dementia, 75% of the area agency on aging programs have targeted programs specifically for people who are living with dementia. And the same is true for caregivers of people living with dementia. And there is growing interest and growing work in Indian country around reaching out and supporting dementia caregivers because of the high incidence of dementia among tribal elders.
Yeah. I think a larger context for the National Family Caregiving Support Program, I certainly am a big believer, and I think many people in all of our communities are throughout the states and the area agency on aging regions, is the issue of, has that program been scaled up to the degree that it should be to meet the actual needs of caregivers? I mean, if you look at the budget of that support program, it has stayed relatively flat for a long period of time. And when you contrast that with, say, the caregiving support service budget for, like, say, the VA, which serves a far fewer number of caregivers, although what they provide is very needed, don't get me wrong, is that I think there's some time for, I think it's time for right sizing of this program through the Older Americans Act. Or
I couldn't agree
And I'm
with
sure
you
you
more,
couldn't agree
Joe.
more.
I couldn't agree with you more.
Yes,
and I am
let me
hoping, I
make
am
that
truly
case.
hoping
Certainly agree with
with
that.
the Biden administration's focus on caregiving and the fact that they've also looked at it from a caring economy perspective,
Yes.
recognizing the importance of supporting caregivers from a human perspective, but also the financial implications of caregiving and keeping caregivers active and productive in the economy. I just hope that we are now at a point where this has become a national discussion and a national issue, and that families advocate for this, recognizing that, it's the old Rosalind Carter adage, if you aren't a caregiver now, you will be. And recognizing that we all have a stake in this.
Yeah, I think caregiving as infrastructure, I mean, we're probably preaching to the choir to ourselves, but that's what I mean, personally, that's what I believe. Mike, did you have a comment quickly? You were gonna
Well, I appreciate you bringing up that point about right sizing the size of that program, because and again, you're completely right. We don't take anything away from services that are being offered to veterans or anybody who is being served through the VA, but especially from a policy standpoint, there are a lot of members of Congress who have an experience caring for an aging parent with Alzheimer's or dementia or something related to that. And the numbers, just in terms of proportion that you were referring to, Joe, is we estimate there's about 5 million military or veteran caregivers, but within the dementia or Alzheimer's community, that's triple the size. It's about 15 million. So
I mean,
yeah.
the problem is that it comes from a different committee and a different budget. So, I mean, the VA budget is completely separate. So really what needs to happen, and I mean, I argued for this when I was at AOA about 100 million years ago, that, we needed to get money from CMS to actually support a family support program, that the little bits of crumbs we were getting for the family support program at AOA was not sufficient. So it needs to be framed within a much larger discussion of our big payers, Medicare and Medicaid, and where do those dollars go, and how much of this workforce is actually providing the care that is really the infrastructure for a lot of their system. So until we do that, we continue, I think, to get really small amounts of money. So I agree, we need to really elevate this.
Okay, thank you. Ellen Lawless fearlessly raised her hand on Zoom. I'm going to try to unmute you, or I'm sorry, it's Eileen. Sorry, Eileen. I'm going to try to unmute you here, and let's see if you can speak your question. So let's give this a shot.
I just wanted to say I'm so excited for this presentation. At the University of Arizona, we actually offer assistance to those who are caregivers of adults and elders, as well as children and family. So this is so exciting to hear, and just on a university perspective, looking to see how we can work with public health and within the university. I'm just so excited, and just to try to be part of this process of attention, of advocacy, and recognition and relevance. So thank you for your time.
No, thank you, Eileen. Thanks for that wonderful comment. And we're so glad you could be here today. And, you know, as someone that's in a school of public health, I share Dr. Stone's concerns that aging isn't necessarily elevated to the point it should be in public health. I know that on a day-to-day basis, and that's something I'm trying to advocate for every day in this university, which was the former home of luminaries such as Bob Kane and Rosalie Kane, who very much were at the forefront of this issue. And it's an ongoing struggle, but it's something we're going to continue to emphasize here. I'm going to try to see if Bill has made a number of great comments here today. Bill, did you want to maybe speak some of your questions and comments out loud here?
I did. Thank you, Joe. Somewhat of an under the radar issue I want to share with people that I work in an agency that serves adults with intellectual and developmental disabilities, many of whom have physical disabilities. And I want to share that today, people with intellectual and developmental disabilities are the first generation to outlive their parents in significant numbers. Many of them live with their families throughout their adult lives. Locally, what we see is families, the primary caregivers, aging out of their ability to provide care, with many needing care themselves. Often there is no succession plan in place once the primary caregiver can no longer continue. This issue is generally true for families who have children with either very involved disabilities or chronic health conditions. And I'm wondering if there are any efforts out there to reach out to these families to make caregiving transitions within the family. And lastly, I would say that although it's wonderful and great that we're focusing on all the things that we're talking about today, that for families with children with involved disabilities, their caregiving starts at birth. And so it might be interesting to include the whole life cycle as we go forward. Thank you.
Great point, Bill. Thank you for making it. I think a really thoughtful one. Heidi, I don't know if you want to talk a little bit about what some of CDC's efforts have been on this front first, and then maybe some others on the panel would like to share on that. About that.
Sure. Thanks, Joe. CDC has been involved in caregiving for many years, not just over the past year or so with the BOLD program, but we have had many years of family caregiving work on, and a lot of it is on our webpage, but also we host the optional module on the BRFSS, and I've analyzed that for years. We've also done quite a bit of work with on analyzing different aspects of caregiving. We had, and the module, we've been collecting data since 2015. So, but with regard to our recent reach out into public health agencies and partnerships with people like you, really trying to gather that information we need so that we can really make really great decisions about the things that we're passionate about. One of the main pieces of work recently that's relevant for this group as well is the public health roadmap for dementia, and it's a state and local roadmap as well as a roadmap for Indian country that shows the various different actions that can be taken for not only for dementia early detection and risk reduction, but also a really big component of that is dementia caregiving. And so we have recommended actions that health departments can take, and we're helping agencies walk through that through action institutes with ASTO and with and different fact-finding missions with regard to helping those states really discover who their populations are, finding partnerships with AAAs and their area agencies, their aging departments, finding out what's being done and elevating that to work to be systemic in the state. And the roadmap is very consistent with the RAISE Council work, because what we've done, we've had representation on that council as well. And we're trying to, we've had of the roadmaps, we've had 3 already. And every time caregiving becomes more and more of a piece, an important piece of that puzzle. And so I hope that continues on in the future.
Heidi, did you want to talk a little bit about the component B program too, that's specifically working in this space? Because I think that's important and relevant to what Bill had mentioned.
Oh, I'm sorry, for the intellectual disabilities.
That's right. Yeah.
Okay, sorry. Yeah. So the National Healthy Brain Initiative has this has a new focus. We have a major partnership with the Alzheimer's Association, but we also have 3 other awardees that are working on certain segments of the population. And we do have the University of Illinois at Chicago working on intellectual disabilities as a component of this bold work in dementia and dementia caregiving. So they have done great strides to work on really targeting the work and translating that work so that population is included. And Joe, I don't know if you want to add any more about I know they're developing their own roadmap for intellectual disabilities and dementia, and we're trying to make sure that there is more education and more tools for decision makers and families when it comes to that.
Yeah, I mean, I don't have much to add beyond Bill. I think it's worth to, stay on our email list. The members of that component B program are in our center as well. And when they start actually developing programming and activities and resources in this very critical space of people living with IDD and caregiving, that we can share them with you. So thanks again.
And Joe, I just want to also mention, CDC does have a newsletter that every time something comes out from one of our partners or ourselves about the work we do, we have over 60,000 people on that mailing list. So if you'd like to sign up for that, you can go to our cdc.gov/aging and become one of the first people to know as those things pop out.
That's great, Heidi. Thank you. That's great point. Really good question here as well. I'm going to open this up for the whole panel because I think this is a really provocative point. And I think it has cultural ramifications as well. This is from Linda Estevillo. Is there an alternative word for surveillance when presenting the need for collecting data? It could cause some resistance to participate. I think it's a really great point. I wonder what people think on the panel.
Well, I'll start, I guess, because that's one of the things that we talk about as federal agencies. That term just rolls off our tongues because we understand what that means, the nuances of that. But we've also often used other terms, data collection or observation. But really the idea is that you're getting to know that population you're serving and understanding the demographics. I think we have as we talk about surveillance, if anyone has any other thoughts about the terminology.
Yeah, this is Robin. I do think it's a horrible word in terms of how the connotation has become so negative in terms of, bad stuff happening through surveillance. But I think the important thing, as Heidi was saying, and even more to the point of why are we collecting the data? That's why I think it is so important. If you're trying to use the information to actually make decisions around how resources are going to be used and how you actually get good interventions and target populations, which is the big role for public health, that's why we need it. So I think it's, you're right, the word perhaps, maybe this is like an inside ball game discussion we're having here, but that term is not something probably for external public consumption because it is completely loaded. But I think the more important point is why are we collecting these data? And, this is not for, that's why the surveillance word is so horrific, but it's really about using the data to actually help us make decisions and improve the health writ large of the caregiving population.
Right.
Just a couple of comments to add on to that. In terms of developing the framework, we wanted to use language that was already within public health, like what public health was already using. So we stuck with that terminology because that was what was already there. But we did consider, using the term data collection. And one of the connotations that came to my head was, oh, wait, are you trying to, like, you know, social media companies trying to get information so they can sell me stuff? You know, we're not talking about that either. So the terminology definitely is a problem. But you know, the things we really wanted to focus on under that pillar was to distinguish the actions that could be taken through entities like the CDC or federal level agencies versus schools of public health, for example, or academics just in the field. So that's why we distinguish between the two. One would be more, you know, federal level data collection entity type of stuff, and the other is more, and somebody referred to this earlier, that's why I wanted to just bring the shout out to really the contribution that schools of public health and researchers in public health can contribute to this conversation as well.
Yeah, and Mike, I just want to add one thing. And I was looking at the way we describe it in the publications that are outward facing, because I think we do use that term surveillance internally to our own partners and such. And the term that is used in the essential services of public health is monitor and evaluate. So it's definitely an easier thing to understand the use of the data. And Robin was right. It's all about getting to know the population. So you're using your funds, your efforts, your time to make the most impact in where it's needed the most.
Great. Let's see how many more questions. There are tons of comments and questions here, so I'm kind of navigating through all these. Here's the next one. This may be our last one here for today. So this is from Desiree Buckman. I am so glad you're doing this webinar. I have worked at several nonprofit organizations, including the pioneering PACE program, Unlock Lifeways. Awesome, Desiree, that's my comment. And I remember asking our emergency preparedness director, how do we address dealing with the elder population, especially elders with dementia in an emergency situation? How do you evacuate older people with dementia, for instance? How do you address the family's needs? And so many other questions. Thank you for everything that you are doing. I don't know, Robin, if you wanted to maybe provide a brief comment on that, or anybody else.
I just think I think we're raising the issues. I think the devil's in the details of how we get this done. And I know there's at least someone sent me a note about what's happening in California around this response. But I think the caregivers, people living with dementia and their caregivers, if there's one issue that is so critical, it is knowing where those caregivers are, because the preparation and the response and the follow-up after any kind of emergency, and with climate change, we're going to be seeing more and more and more of this. It's just critical. So that, to get back to Heidi's point, that's why we need these data, because we need to know in these high-risk communities, where are these vulnerable spots? And do we have the caregiver contacts to be able to work with them in an emergency? So, that it all fits together at this point. The role of public health, emergency preparedness and response, data collection, it all comes together around this.
Yeah, Joe, if I could just jump in too, is, just to follow up on Robin's great response, is that, again, hearkening back to COVID, one of the challenges that we faced at the beginning of the COVID crisis is that people who worked with older adults and people with disabilities were not considered essential workers. And that has got to change. When a disaster happens and FEMA comes in, people who worked with our populations were not brought to the table. And that has got to change. Because, whether it be the fires in California or hurricane in North Carolina, I don't care. The fatalities that happen, the highest level of fatalities are older adults and people with disabilities, and that can be changed if we intervene.
Right.
Yes.
Absolutely. Absolutely.
Yeah, and I just wanted to point out a resource that was recently developed because of the issues we did have with COVID, and all the great information that came out of that response was this renewed effort to create a place where public health agencies and others can go to help the people they serve. And so I just put that into chat. It's called searchfindhelp.org. And it's for public health agencies and organizations that serve older adults and caregivers, with specific information about how to in public health emergencies. So I just urge people to go look at that as well.
Well, everyone, thank you. We could have kept going here for another hour. There were so many great, robust comments, really thought-provoking ones too. I wish we had more time to go through them. I apologize for those of you that did submit comments. I think we got through most of the questions, but to wrap up here today, again, connect with us, please. Again, the slides and everything and the recording from today's talk, as well as from all of our other various activities and resources, are available on the website bolddementiacaregiving.org. If you would like technical assistance to support your public health work in dementia caregiving, there's also a place on the website where you can fill out a very quick form. We are here to assist and help you and advance your work and efforts related to supporting people who are caring for individuals living with dementia. And also too, after today, if you're not already, we'll be putting you on an email list to again keep you informed of all of our upcoming events. Thank you again for joining us today. Thank you so very much to our incredible panel. This was just a great webinar, so chock full of information and insights. And one last request, please do take a moment to complete our evaluation form at the end of this presentation, which I believe will pop up on your Zoom. That helps us, again, further tailor and inform our future offerings. Thanks again, everyone. Have a great weekend, and really appreciate your time today. Thanks, everybody.
Thank
Bye,
you.
everybody.